Wahab, Associate Professor, Department of Pharmacy, Quat University of Science and Technology. Our today's topic is pharmacoeconomic analysis, but we would like to discuss the cost minimization analysis in detail. As you can see over here in discussion outlines, pharmacoeconomic analysis, and we would like to discuss the cost minimization analysis in detail. So the definition of cost minimization analysis, their examples, and also the characteristics of the cost minimization analysis, advantages and disadvantages of cost minimization analysis. So you can see over here the pharmacoeconomic analysis. So there are different types of pharmacoeconomic analysis, like you can see over here: cost of illness analysis, cost minimization analysis, cost effectiveness analysis, cost benefit analysis, cost utility analysis. But our main topic is cost minimization analysis for our today's topic, for our today's discussion. So in cost of illness analysis, evaluation of overall economic impact of a disease on a population. In cost minimization analysis, assumes equal outcomes, and cost effectiveness analysis measures outcomes in natural or physical units, while in case of cost benefit analysis, measures both benefit and cost in monetary terms, and cost utility analysis measures outcomes in QALY, QALY, quality adjusted life year. So it is the diagrammatic presentation of the different analysis, like cost of illness analysis, cost of minimization analysis, cost effective analysis, cost benefit analysis, and cost utility analysis. So today, as I told you, that we are going to discuss about the cost minimization analysis. So this type of evaluation compares, and this type of analysis compares two or more alternative treatments that produce clinically equivalent outcomes. Clinically equivalent outcomes. It means that the outcomes, the clinical effects of two drugs must be same. So if we are going to compare the cost of two drugs or two products, so we should keep in our mind that the outcomes or clinical consequences of such type of drugs must be same. So in cost minimization analysis, the alternatives must have an assumed or demonstrated equivalency in safety and efficacy. Similarly, cost minimization has the advantage of being the simplest to conduct because the outcomes are assumed to be equivalent, same. Thus, only the cost of the interventions are compared. The cost of the interventions are compared. Cost minimization analysis cannot be used when outcomes of interventions are different. It is also the disadvantage of cost minimization analysis. We would like to discuss in our coming slides about the advantages and disadvantages of cost minimization analysis. So in disadvantages, it is that cost minimization cannot be used when outcomes of intervention are different. Cost minimization is a method of calculating drug cost to project the least costly drug or therapeutic modality. Cost minimization is used to compare products that have been shown to be equivalent in therapeutic effect. A cost minimization analysis can also be used to reflect the cost of preparing and administering a dose of a medicine are the cost of administering a medicine in different settings. Different setting means inpatient and outpatient settings. Because products compared in cost minimization must be shown to be equivalent in therapeutic effect. The cost minimization method is most useful for comparing generic equivalents. A cost minimization may also be used to compare therapeutic equivalents. Cost minimization analysis. One example of cost minimization analysis is the measurement and comparison of cost for two therapeutically equivalent products such as glipizide and glyburide. Another example is the measurement and comparison of using prostaglandin E2 on an inpatient versus an outpatient basis. In both cases, all the outcomes, efficacy, incidence of adverse drug interactions are expected to be equal, but the costs are not. In case of cost minimization analysis, we mostly focus on the costs and we assume that the outcomes must be equivalent, must be same. Treating patients with same therapy in a hospital versus home. These are the example of cost minimization analysis. You can see over here the uh, in this diagrammatic presentation of the cost minimization analysis. If there is a problem, then what should be done? Determine the least costly alternative. If there are two products or two drugs, so and the outcomes or the clinical consequences of both drugs are same, then what should be done? Then the cost should be compared. So the least costly alternative must be selected. So after the least costly alternative selection, the next question is, are outcomes being measured? If the question is no, it means that it is cost analysis, not cost minimization analysis. It is just cost analysis. But if the question is yes, after yes, the second question is, are outcomes equivalent? If the answer is yes, it means that we should apply the cost minimization analysis. But if the answer is no, then cost effective analysis, cost utility analysis, or cost benefit analysis will be used, will be applied. Example of cost minimization analysis. A hospital needs to decide if it should add a new intravenous antibiotic to the formulary, which is therapeutically equivalent to the current antibiotic used in the institution and has the same adverse event profile. The advantage of the new antibiotic is that it only has to be administered once per day versus three times a day for the comparison antibiotic. Because the outcomes are expected to be nearly identical and the objective is to assess the cost to the hospital. For example, the hospital perspective. Only direct medical costs need to be estimated and compared. The direct medical costs include the daily costs of each medication, the pharmacy personnel time used in the preparation of each dose, and the nursing personnel time used in the administration of each dose. Even if the cost of the new medication is a little higher than the cost of the current antibiotic, the lower cost of preparing and administering the new drug once a day versus three times per day may offset the difference. Direct, non medical, indirect, and intangible costs are not expected to differ between these two alternatives and they need not be included if the perspective is that of the hospital. So these costs are not included in the comparison. As you can see over here in this table, uh, type of cost and every 8 hours once daily. As discussed in our previous slide about the two different dosage form uh, which are having the same outcomes, but the different duration of administrations, like you can see uh, in this uh, slide, once a day versus 3 times per day. So if a drug is having a drug acquisition cost is 43.70 and once daily, if a product that is administered once a day and the price for that product is $55.39 and the price for the product which should be administered 3 times a day. So for each product the price is $43.70 and the mini bag cost is 29.32 and for the product which should be administered once a day and the mini bag cost is 10.90 and preparation cost for the product which should be administered after every 8 hours is 13.81 and for the product which should be administered once a day and the preparation cost is $6.20 and administration cost for the products which should be administered every 8 hours is 67.63 dollar and for the product once a daily the administration cost is 25.13 and the total cost for the product which should be administered 3 times a day means every 8 hours that is 154.46 dollar and the total price the total cost for the product which should be administered once a day per day that is 97.62 dollars. So as you can see over here there is a big difference between the total cost of these two dosage forms like you can see in this table the total cost for the product which should be administered 3 times a day is that is 154.46 dollar and for that product which should be administered once a day that is 97.62 dollars. So on the basis of this difference if we are going to apply the cost minimization analysis and in this case the product if the products are having same or equivalent outcomes the clinical consequences, so if the clinical consequences or outcomes are same then what should be done so in this case the product which is having the lowest the least price the least cost should be selected, like you can see over here the product once a day should be selected that is the cost for that product is $96.62. The characteristics of cost minimization analysis. A cost minimization is the simplest type of pharmacoeconomic analysis. It is the characteristic of cost minimization analysis. In a cost minimization analysis, only the cost of treatments are compared between two or more interventions. Only the cost of treatments are compared between two or more interventions or products because the health outcomes are identical. are assumed to be identical. If there is difference between the outcomes, we can say the clinical outcomes, then we can't apply the cost minimization analysis. So the input measures for a cost minimization analysis is cost, and the outcomes are assumed to be equivalent. A cost minimization analysis can be used to compare a brand name item to a generic equivalent. Two generic equivalents can be compared, or the administration of the same medicines in different settings, outpatients versus inpatients. Advantages and disadvantages. An advantage of a cost minimization is that it is simple to conduct, and disadvantages include the fact that it can't be employed when outcomes of the products are not equivalent. And types of interventions and products that can be compared in cost minimizations are limited because the outcome must be equivalent. So these are the references for our today's topic. Thank you so much. In our coming lectures, uh, we would like to discuss about the other pharmacoeconomic analysis. Stay blessed. Allah Hafiz.